Spinal cord injury can happen at any time. It's an unplanned event. It comes out of the blue, and in a fraction of a second in an accident or in a few hours, people's lives are changed forever.
The big obvious effect is that somebody's in a wheelchair, and so the difficulty with walking and with getting around is what people know, that's what they understand. But your body is very complicated and there's a whole bunch of other stuff that doesn't work right. Everybody sees the physical disability, but the other hidden costs, the quality of life costs, are enormous, and we need to do something about it.
Research isn't something that happens in the lab or away from the clinical setting. As soon as we know information, we can start acting on it, and even while we're piecing together the puzzle, sometimes the people who are participating in the study are reaping the benefits straight away, even before we have the confirmed study outcomes.
People with spinal cord injury have trouble with their cardiovascular system, so they run into trouble with heart attacks and with strokes. They have trouble with managing their bowel and their bladder, and this can take up an enormous amount of time.
A little while ago, I was working with a patient on one side of the room, and I was telling him about the CPAP mask and how it would work and what would happen. And the patient across the way, when I finished, called me over and he said, "Oh, I've always wanted to try one of those masks. You know, I think I've got a bit of a problem with obstructive sleep apnea, you know, could I try?" So I said, yeah, sure. I set him up with a mask and a machine that night. I came back in the next morning and I said, "So how did you go? Did you use the mask last night?" And he said, "Oh yes, I used the mask all night, and I read 10 pages of my book this morning." And he said, "This is the first time since my injury I've been able to read more than half a page of a book."
If we could manage to shorten that time in the morning for getting ready by a better bowel treatment that emptied the bowel predictably with no chance of an accident, then of course people feel free to go out and about, to have a job, to take part in life fully. For the chest it's the same. How can we make it so that people can take big breaths and not get chest infections?
For a quadriplegic, it costs around $9.7 million over their lifetime, and for somebody who's got a paraplegia, about $5.1 million.
With your support, spinal cord research can transform the lives of people with spinal cord injury.